Welcome back in. Fitz the Bill rolling right along right here on 1061 ESPN Richmond. I'm Jack Fitzpatrick, joined now by Dr. Anthony Karam from OrthoVirginia. Dr. Karam, thank you so much for taking some time out of your morning to chat with us.
And thank you for having me on the show. I appreciate it.
Of course, I want to start here. Look, I'm a radio host. I got to do some of my pre-interview research, right? And I was reading your bio, and it said you're a former engineer who then turned to being a doctor. Can you walk me through that career change?
That is correct. So I studied chemical engineering when I was an undergrad, and as being part of that, in that discipline, it wasn't like a very big transition in the medicine because we had to take all of our science prerequisites and everything to fulfill the engineering and chemical engineering requirement for my discipline. So all I had to do was to take like 2 extra classes. It wasn't like anything like above and beyond or anything crazy like that. And I did have to take the MCATs, which I took my senior year of college, and then I ended up working as an engineer for like a year or so, just to give it a shot, see if it was something that I wanted to do with my career, even though I had something in the back of my head about going to medical school and exploring that entire field. I ended up working for a consulting firm, and then after that I decided that that wasn't for me, and I then pursued my dream of becoming a physician, and now I'm here 15 years later. So
that's awesome. What do you specialize in at OrthoVirginia? What's your day to day?
So my specialty is interventional pain and spine. I do mostly spine related conditions and minimally invasive procedures, as well as in injections for back pain, neck pain, things like that at OrthoVirginia.
Well, you nailed on something that we've been hearing a lot in this NFL season: back pain, something that has plagued Matthew Stafford, Micah Parsons. Both played in week 1 of the NFL season. However, both reportedly received epidurals to help with their back pain. Can you kind of walk us through that approach for pain management, especially with backs, when it comes to a professional athlete?
Sure. Professional athletes they're very young folks, very healthy folks. Folks that probably their injuries are more related to acute trauma than anything else. They're not going to have the typical, arthritis that we see from chronic wear and tear. They might have some of that due to the nature of their sports activities and things like that. However, their injuries tend to be more acute. So, with regards to, I think Matthew Stafford, correct, on the Vikings, he had a herniated disc, and that can cause a lot of pain, especially in the acute phase of that. They could have pain with bending, pain with really any movement I see with people with that kind of injury, especially like I know as of late, my wife was experiencing that kind of issue, and we had to get that taken care of for her as well. But usually with these kind of things, the helping through that initial acute phase is what our plan is with athletes. And that's probably why Stafford and Parsons underwent epidural steroid injections, just to help decrease the inflammation as a result of the herniated discs and things that they have in their spine, so that they can get back to playing faster. And that's important for any athlete, especially a professional athlete. We want to get them back in the game as quickly as possible, as pain-free as possible, so that they're able to do the things that they need to do to play.
Dr. Karam joining us from OrthoVirginia on this morning. Dr. Karam, you mentioned it. They go through the epidurals, things of that sort. Could you kind of explain if and when non-surgical pain treatments can, like when you decide non-surgery and kind of doing the epidural side is the best route forward compared to maybe going and doing a surgery or something along those lines?
Sure. Usually patients that initially present in the acute phase with a disc herniation, we really want to treat that conservatively first. That being because most patients, I would say 80 to 90% of patients that I see with this issue don't need spine surgery. And we don't want to alter the biomechanics of the spine unless we absolutely have to. And I'm not a spine surgeon, so I know spine surgeons, some spine surgeons can talk to this in greater detail than I can, for sure, because that's a little bit out of my wheelhouse. But, with any type of acute injury, we typically want to start with the most conservative thing first that we can possibly do to make our patients better, and we go from there. In terms of some of the higher performance athletes, obviously we would want to get them pain free as possible to get them back on the field. So I would probably move doing an epidural or doing some type of intervention for them a little bit further up so that we can get them back to playing and back to moving. Again, like I said, so, conservative, physical therapy is a great option for most people to start off with, to really help stabilize and build up the musculature around the spine to make sure, we're helping patients, heal and move in a effective and, pain-free manner. Typically if patients are still kind of having pain and they're still in that acute phase, we'll do that epidural so we can get them moving easier and get them, get back some of their quality of life, because most people with these kind of disc issues, they're absolutely miserable in that initial phase.
Yeah, someone who has thankfully not ever had issues like that, hopefully ever will have not had to experience that type of pain. Are there any emerging pain treatment technologies out there or techniques that you're really excited about?
Sure. Yeah, there's a few things that have been happening in the space of pain medicine, especially that have been pretty exciting. We're very big on neuromodulation now, which basically means we're using electricity to stimulate nerves so they don't feel pain. And that's pretty exciting. We're basically blocking the pain signal by utilizing electricity. And now, by the way of spinal cord stimulation or peripheral nerve stimulation, these are really new emerging technologies in pain medicine. And the interesting thing about pain medicine is just so much technology is changing it changes very rapidly. Like we really have to stay up to date to make sure that we're able to offer our patients the most up-to-date evidence-based treatments that we can. And, that's the important thing with any new emerging technology, is making sure that we vet that evidence and we vet that data to make sure that we're doing things for our patients that are going to not only work, but are also durable for them. And, obviously also, agree with their overall goals and getting better in their overall activity.
That's awesome. I also want to know, kind of on the flip side, any pain management technology or techniques you advise people to kind of be a little cautious about right now?
There are some pain management technology or techniques that I would advise people to be cautious about. There's a lot of new emerging things in the field of regenerative medicine and biologics. The data on that is currently being researched and done, and sometimes these newer technologies and these newer techniques need to be vetted by somebody that has the knowledge, so that we are sure that we're doing something for a patient that's actually going to work and that's backed by good quality data, good quality science.
That makes a lot of sense. Dr. Karam, can you let listeners know where they can go? I was getting ahead of myself on that one. Where they can potentially schedule an appointment at OrthoVirginia and can find out which pain management options, everything like that, are best for them?
Sure, they can go onto our website to schedule an appointment. They can call our office directly. I don't have the number off the top of my head, but they can call our offices, go to our website to schedule appointments, and obviously we would be more than happy to see and help. We want to help and reach as many patients as we can here at OrthoVirginia, so we can get them working and moving and feeling great.
Awesome. Dr. Karam, thank you so much for taking some time out of your day to chat with us. Have a wonderful rest of your week, and appreciate your time.
Thank you.